Hi everyone! Today in this clip, I will be showing you how to do segmental analysis for the knee joint and the hip joint from side view. Okay, to start with the knee joint, we want to check whether his knee joint is in neutral, flexed or hyperextended. The reason why we do this static posture analysis is to give you a good guideline of how to start design a program for your client. To begin with the knee joint, I would have to palpate two bony landmarks. One is his side ankle bone. Two, his greater trochanter. Okay, so side ankle bone, you can find the bone here pretty easily. You want to have your starting point slightly in front of his ankle bone. Then you are going to find his greater trochanter. The way to find it, you know the greater trochanter is the bone on the outside of the femur. Okay, so you know roughly that is his top of his femur is here. Then you ask him to maybe perhaps lift your heel slightly off and then rotate your knee from side to side. So you can feel that bone moving inside the hip joint. Okay, so once you find it, you ask him to stand on his feet again. We'll have one finger press here so that for you to be able to check. So I step out to the side and then I look from the side view, connecting the two bony landmarks, connecting his greater trochanter to his ankle bone. Okay, so I'm drawing the line straight and the line will fall through his knee joint. And I realize that the line falls through slightly behind center of his knee joint. Okay, what that means is his knee joint or his right knee joint is flexed. If the line falls mostly in front of the center of his knee joint, then his knee joint will be hyperextended. From here, I will go up to his hip joint. Okay, I have already found his greater trochanter. Now I need to find the top of his iliac crest. Okay, the way to find this is I look for his PSIS, posterior superior iliac spine. Okay, so it's the bone behind his hips and the front hip bones, anterior superior iliac spine. Once I found these two bones, I walk up on his ilium and I find the center of his in between PSIS and ASIS, and it's here. Okay, so you can ask him to have one of his finger here. You step aside again and look from the side view, connecting these two bony landmarks. You can see very clearly here that greater trochanter is not directly below the top of his iliac crest. In other words, it's not vertical. His greater trochanter is behind the top of his iliac crest. So this means his right hip joint is flexed. Okay? In other words, if his greater trochanter is in front of the top of his iliac crest, pretend, then the definition of his right hip joint will be extended. So be sure to follow me on another clip and I will tell you how to design a program for these two specific joints of his condition. Thank you.